In the last 24 hours, Health Minister Dr. Zweli Mkhize announced 40 more COVID-19 related deaths and 1,731 new infections. South Africa's COVID-19 cases now stand at 735,906. To speak about what could be behind this resurgence, the National Institute of Communicable Diseases daily report said that Gauteng still has the highest number of cases with 229,872 cases, followed by KwaZulu-Natal with 123,517, and the Western Cape, of course, has 118,549 cases. Dr. Ridwan Suleiman from the CSIR joins us now to talk about what are the reasons we're seeing these numbers. Dr. Suleiman, good evening to you. Thanks again, once again, for taking the time to speak to us. So let's talk about the average daily COVID-19 cases per week. Has it increased exponentially over the past couple of weeks since we descended down to alert level 1?
Good evening, Skepiso. Lovely to be with you again. Yes, I think to answer that question, perhaps I can start by looking at a national level as before, and then perhaps if we can maybe zoom in on a provincial level. On a national level, currently the 7-day average of confirmed cases is 1,490 per day. Now that number of around 1,500 cases per day has been steady for at least the past 2 months or so, and that can be seen if we track the data, looking at weekly averages. We're seeing about 1,500 cases per day for the last 2 months or so. What's important at this stage of our pandemic is perhaps to zoom in on provincial levels or even hotspot level, if possible, because as we've seen previously that the timing and the spread of the infection has varied in the different provinces. And I think we need to try and look at that to pick up any particular resurgence or any clusters. As we know, that's how the infection outbreaks. The other important thing to look out for at this point in our tracking the pandemic is the test positivity rate. I think that's another crucial measure to follow going forward.
So let's look at the incidence rate per province. As you say, the Health Minister himself saying that they're still very much on high alert for a resurgence in the provinces. So how's the picture different?
Sure. So if you look at the incidence rate per province, which is the 7-day average of confirmed cases per province scaled per 100,000 people per province, what we can see is firstly the variation in the timing and spread of the infection at different in the different provinces. Right now, essentially Free State and Northern Cape are just about getting over their first wave still. The big concern looking at the incidence rate at the moment is the steep rise in cases in Eastern Cape. It's rising quite rapidly. 2 weeks ago, the Eastern Cape was reporting about 250 cases per day. At the moment, we're looking at 576 new confirmed cases in the Eastern Cape per day. Now that's more than doubled in the last 2 weeks, and the steep rise in infection rate is a big concern. There is a slight increase in the Western Cape as well, although nothing too significant at the moment. All the other provinces are on a downward trend.
As you mentioned, test positivity and the detection thereof is important. So let's look at that daily average of tests being done per week. And I want you to also talk to us about the importance of when and whom is being tested and at which point.
Sure. So if you look at the number of tests that are being conducted at the moment, on average, it's about 20,000 tests per day. This has increased a bit since the beginning of level 1, but we kind of steadied off at around this figure of 20,000 per day. The increase in the number of tests has been due to the easing of the testing criteria, which we had for a long time, in fact, up until the start of level 1. So that testing criteria has eased, and I believe testing is now more accessible rather than having to meet certain criteria. That being said, the number of tests isn't quite sufficient to actually, together with quick turnaround times and sufficient contact tracing, to actually keep up with the spread of the infection still. What we may possibly look into going forward is, instead of forward tracing potential infections, perhaps look at using cheap rapid tests and backward tracing to identify infection events or super spreading events. What's also important now to look at is what proportion of those tests that we're conducting are returning positive results.
So let's do that. Look at that on an average daily basis per week. And as you say, the quality of the tests, then now new rapid diagnostic tests. But you'll find that some countries have decided, especially on the African continent, have decided not to test because they say they don't want to waste resources. The minister is already saying that our resources are dwindling because of the economy. So having an average daily test, looking at it per week, how important is that?
Sure. I think you've highlighted a very important point that testing is a costly initiative. And even though we're using very accurate PCR tests at the moment, it may not be the easiest thing to justify economically. That being said, this still remains a vital tool and one of the tools in our toolkit to combat the virus. So looking at the test positivity rate, which is the percentage or proportion of tests that are returning positive results, if we look at a national level, the good news is that this test positivity rate is currently at 7.5% and is steadily still decreasing. And that's the good news. I think once this particular if this particular metric starts to increase, that should signal red flags. So at a test positivity rate of around 7.5%, it's still relatively high because we're finding a positive or confirmed case for every 13 tests conducted. But this number will decrease as the number of tests are increasing and as the testing is done more widely. Again, I think important to look now at zooming in on the provincial level and to try and pick up any variation in the test positivity rates in the provinces is quite crucial.
I'm glad you're raising that because, the minister was also lamenting the fact that this fatigue, this COVID-19 fatigue or complacency is what's creating a problem of what he sees as recklessness. We know the president is expected to speak to us in the coming week because of this. So let's look at the provinces that are not performing well, so to speak, in this regard.
Sure. If we look specifically in terms of the measure of test positivity rate, yes. There's a large variation between the provinces, from 4% to up to 24% between the different provinces. The big concern is that 24% test positivity rate currently in Eastern Cape. It's risen quite steeply, it's just been over the past few weeks, similar to the trend we're seeing in cases. The number of tests that are returning positive are also increasing significantly. And we need to identify what the reasons are for this, and we need to try and limit or mitigate the circumstances behind this before it gets out of control. You bring out a very important point about the adherence to the non-pharmaceutical interventions. I think that's still a critical tool for us in combating the virus at this stage. The numbers are relatively low compared to what we've seen before, and during the warmer summer months at the moment, it's important that we remain vigilant on these non-pharmaceutical interventions. That's wearing a mask, maintaining good hygienic practices, but also limiting the conditions that are there for super spreading events. So avoiding overcrowded places, closed spaces in close contact, because those are the conditions where you see these super spreading events. And I'm sure those will be highlighted in the coming week as well.
Now, also of importance to understand the dangers of a second wave is the hospitalizations and deaths. So I want us to start by looking at the average daily deaths per week in hospitals and whether or not there's been an increase there as well.
Sure. So if we first look at the average daily deaths per week, currently we're seeing on average 73 deaths per day if you look at a 7-day average for that figure. So we're back to where we were at the start of level 1 in terms of the number of deaths reported per day. if you track the number of deaths over time, it hasn't quite followed the number of cases, which it should. And the reason for that is because of a change essentially in reporting, where many of the provinces over the past month are identifying unreported deaths and auditing the deaths data with that from the Home Affairs as well as from facilities that are reporting deaths. So a lot of the deaths that are being reported on a daily basis, it's difficult it's difficult to quantify exactly what is current and what is reporting historical or unreported deaths from before. But essentially, it's quite steady and at a level similar to where we were at the beginning of level 1.
Is that the same with the average daily hospital admissions?
It is very similar. If you look at the average daily hospital admissions across the country, it's following a very similar trend to the confirmed cases. Currently, it's quite steady, similar to the confirmed cases, steady at a number of around 1,500 new admissions per day, and that's generally been for the past 4 to 8 weeks. So on a national level, that particular measure is also quite steady. However, if we look further at a provincial level, the Eastern Cape, again, we're starting to see an increase in the number of hospital admissions in that province. So it's not just one particular measure, but all the indicators are quite worrisome for that particular province. All of the other provinces are showing downward trends in hospitalizations.
In short, should South Africans be concerned about these figures?
I don't think there's cause to be alarmed or to panic yet. I think the case numbers are manageable at this stage. We need to remain vigilant and focus on the measures that have shown and have proven to slow the rate of transmission. We need to focus on the non-pharmaceutical interventions, wearing a mask, maintaining good hygienic practices. But we also need to be aware of the conditions and limit the conditions for super spreading events. I think the risk of further outbreaks always remains. However, there's no need to be alarmed at this stage. We certainly can do quite a bit to slow down the rate of transmission at the moment.
Ridwan, always a pleasure. Thank you so much. Ridwan Suleiman, Dr. Ridwan Suleiman is a senior researcher at the CSIR, the Center for Scientific and